welcome to another video where today we're going to be talking about tight quads and how they exacerbate knee pain, but they may not actually be the reason for it, the underlying reason anyway. So knee pain, very common, affects a lot of people throughout the world, of people of all ages. So a bit like back pain, it can really take down an elite athlete as much as a really old person who does nothing. It sort of doesn't discriminate. It's like poor movement will always be the underlying problem for people, unless it was from a traumatic accident. But prior to the onset of pain, there's always sort of a stiffness that sort of develops in the quadriceps, and especially when it's from something, when you develop pain from something that wasn't a specific event, you sort of need to look closely what was the thing leading up to it that was causing the problem, instead of just trying to treat the symptoms. So a lot of people just try to get rid of the pain at the knee, but really, and I've been over this many times in other videos before, there's always something elsewhere away from the knee that's usually the problem. And recently I've seen a lot of people who with severe loss of knee mobility that could have been prevented if they had the correct action taken early on. So, and these people are sort of coming to see me with severe stages of knee osteoarthritis, and they had stiffness in their quads for a long time before it got to that stage, and they could have done something about it early on that would have been actually quite simple too. So I love this quote, moving isn't important till you can't, and it's always when people can't move that they really realise they should do something about it, when it should have been done well beforehand when there was a warning signal of stiffness. So one thing you need to get your head around, which is a bit like with the upper traps, is that the tightness is often a protective mechanism. So in many cases the tightness is to do with weakness and poor alignment. So as opposed to what we would think as being quads being too strong, there's a big difference between being strong and tight. All right, so tightness is more or less trying to restrict more movement at the joint. It's trying to stop you from using the joint because there's something wrong with it, and you need to find out what that is and fix it. Otherwise, it has to use stiffness to protect it. You can't just stretch it and get rid of it, the stiffness, if you're leaving the problem still there. So you have to really address, why did it become stiff in the first place? And most of the time it's from this poor alignment, as you can see in the picture here, and there's a bit of a magnified response of like how the cartilage, ligaments, tendons, all getting compressed and squashed. And if you keep using it like that, the body has no choice but to come up with a different strategy for it. So this is where our instincts, you can sort of feel the stiffness in your instincts are sort of saying, well, stretch it and release it. And this is sometimes where it betrays, our instincts betray us, because, and this is also why it doesn't go away, no matter how much stretching you do, it tends to remain, and in some cases it even makes the stiffness even worse. So because the reason for that is it doesn't really address the faulty alignment that we just showed you. It's just trying to remove the reaction to it, but not the reason that it was there. So stretching is not the answer. What are you supposed to do? Well, there's several things you need to do, but as I'm going to show you, that the order in which you do them are just important as the strategy itself. So firstly, you need to understand that the quad muscles they're not all the same. The way that they're sort of programmed and designed are different. So the rectus femoris is the main one, and you can sort of see here, that's the one that you usually see, the big one on the outside. And it's a very unique muscle in that it can extend the knee joint and the hip joint. It sort of crosses two joints. So you can see how it crosses this joint and that joint. So it has the ability to act as a hip flexor as well as a knee extensor. The vastus lateralis, which is on the outside, that one is often a bit of a problem muscle, because it can start to inhibit the one on the inside, being the vastus medialis, which is often called VMO. All right, and this one is very crucial to the stability of the knee and obviously maintaining the alignment. But it has, and I'm going to show you in a second how these muscles different. The fourth one, the intermedius, sort of lies on the front underneath the fem, so you can't actually see it. It's sort of hidden from You can sort of see here, not visible, so but it's right underneath these guys. So there's 4 muscles to the quads. Now, where I say they're not the same is that some of them are prone to being a tonic muscle and others are prone to being a phasic muscle. So the tonic muscles, especially when something goes wrong within the system, their tendency is to tighten and start working for like overworking and shorten up to try and create more stability. And these guys are generally slow twitch muscles, not always though. Some muscles switch between the two, and I've sort of listed all the muscles here. But you can see here recfem, all right, quad muscle, it's a tonic muscle. On the opposite side, you can see vastus medialis, all right, and you can see here lateralis. I would actually sort of say it almost flips over in this side, because you can see iliopsoas and the TFL muscle of the hip. These guys are all sort of contributing to be a problem area. They're really going to destroy these guys here, the glutes and the vastus medialis, because these guys here are playing a crucial role in keeping the alignment of the leg. Remember, that's the underlying problem all along. All right, so these guys are going to keep it going, and these guys are going to pretty much allow them to do so. So on the phasic side, which we've just spoken about, which are being the VMO and the glutes as well, these guys are, you know, they're very prone to muscle inhibition. So when something goes wrong, they just more or less switch off, and that's why it's hard to get them to switch on. That's why you hear a lot of things about glute activation. You see a lot of videos for VMO and stuff like that, but it's sort of, they're really quite pointless when you don't sort of apply a good strategy to it. So here's an example of like where the quads sort of go into really stealing work, and it could be partly because of coordination as well. So it's one thing that we have to sort of bear in mind. There may be nothing wrong with the muscles at all. It may be just the way that you use them that's the problem. So, but basically what happens here in a squat movement, I've got sort of 2 different examples of squats here, where the tonic muscles are stealing the work from the phasic ones. So in both cases, this is where a squat where it's almost going knock knees, and very upright, very quad dominant, very much putting a lot of pressure into there. It's sort of not a too bad squat in some regard, but the loss of alignment here is awful. It could be from the hip or it could be from the foot. This one here is another example. This one's common to a hip impingement and disc bulge. This is where a person's really not using their hips at all, just relying 100% on everything to be done through the quads and the knees. So they're very quad dominant, and they're going to develop a huge amount of stiffness and pain here because that's all they use. They don't get any work from the posterior chain at all. And again, like, they're going to create problems through the spine as well. But this is an example of where this is just going to be continually running all the time until the movement strategy is changed. So now you sort of understand a bit of the anatomy, a bit about the quad, what causes them to tighten up and stiffen up. I've sort of given you a few examples there, but there's a few that we have to, that many people don't think of, and I'm going to show you in a second. But overuse of knee flexion, so we're just being, you know, like sitting for extended periods, and poor alignment. So poor alignment is spoken a lot about, but overuse of the knee flexion is another one. So when we look at sitting, this is taken from Dan Pope. He has a lot of good stuff, by the way, if you want to check out his stuff. But basically the quad's attached directly to the kneecap, and the kneecap attaches directly to the tibia, and this basically forms a strap. As the knee flexes further and further, the strap tightens and compresses the patella into what is called the trochlear groove. So this causes compression within the joint. So this is not a bad thing if it's all aligned and it's not done all the time, but if it's left like that for a long time, and especially if you sit in a chair and you love to tuck your feet under the chair, and I must admit I have a habit of doing that myself. If you do that, you create excessive amount of compression into the patella, and then that's where sitting will give you a massive amount of problem, and you'll develop stiffness in the quads. And this is where your instincts betray you, because then you say, well, I want to stretch it, which means you've got to bring it into more knee flexion, but it was the knee flexion that created the stiffness. So actually your strategy to get rid of it is the very one thing that's caused it. This is again where, say, kneeling and sitting on your feet like that. This again, see, if you do this for a long period, you put a lot of pressure into this joint and on the patella itself. So you've got to be very mindful of these sort of things that are really underlying problem, especially sitting. You know, a lot of people who at the moment in lockdowns and stuff like that. I know for myself, my knees have really sort of been playing up. My quads are really stiff on my left leg. So if you leave your body like this, it'll have to react to it by stiffening things to protect the joint. So it'll reduce the amount of flexion you have to stop you from bending it. All right, so too much knee flexion is a huge problem. Doing too much too often as well. So someone who does an excessive amount of jumping and squatting with too much load, with not enough recovery, and not maybe ignoring mobility between workouts and stuff like that. Also, those cause a lot of problems. So the joint's designed for the purpose to handle it, but when the stress is too much and it can't actually have enough recovery time, things start to go wrong. So the more the knee goes into flexion and the harder the quadriceps contract, the greater the forces on the patellofemoral joint. So you just got to bear in mind these things are all good, squatting, running, taking, doing stair runs, stuff like that, but if you use them too often, they'll backfire, they'll work against you. All right, so now once again the body reacts to this in a bad way. So the body tries to limit activities and movements that take us into flexion. So the compensation will lead to the faulty problems. All right, so the stretching paradox, as I sort of touched on a second ago, activities that require more bending tend to put more stress through it. So 3 times your body weight during say just level walking, 3 times your body weight during stair climbing, 6 times during running, and 8 times during like a knee bend or a squat. All right, so to improve flexibility requires full knee flexion, as I'm showing you in this picture here of me doing this stretch. But if knee flexion is the reason for the problem, you can see how this is not a viable solution. You have to look for a different solution, and this is where a lot of people go wrong. And this is where their problem starts to really become a much bigger problem, because they're constantly looking for treatments to get rid of it, but it's not really the sort of like it's your instincts betray you. So correcting the poor alignment. So I've sort of mentioned this before, that the joints above and below the knee are the ones you want to really look at, the ankle and the foot. So because they're the ones that really control the alignment. The knee doesn't really have a lot of capacity to control the pronation or the internal rotation that you'll see that puts it into that point of no return. If those joints aren't doing their role properly, your knees it's inevitable it's going to end up trouble. Right? It just needs a lot of repetitions or excessive amount of load to get it there. So with patella tracking, so when you lower into a squat, as you see here, as we said before, in the sitting position, the kneecap has to engage into the groove, and it's guided down the femur. And as you straighten the knee, when you stand back up, the patella tracks back up the groove. So this is what is known as the patella tracking. So inside of the joint is covered in the cartilage, designed to reduce the stress that occurs in the joint created by the quads. But if it's not aligning in the groove correctly, it starts to sort of wear and tear things around it, and your body senses this danger, and that's when the stiffness starts to take over. So again, in sort of a running position, so poor hip control or poor foot stability, in both cases a bit of excessive pronation and internal rotation. See how this knee gets sort of put in a horrible alignment, and then your quadriceps are going to stiffen to protect that joint. So this is an example of, like, it's not a tight, or it's not even a strong muscle, it's probably a weak muscle in this case, but it's going to stiffen right up, and it's the weakness and timing, but not of itself. It's other areas that are causing it. All right, so when this is where people sort of get the idea, well, if it's weakness and timing problems with the VMO, maybe I just need to isolate it. And you see these rubbish exercises where this is not even a VMO exercise. This is This is a hip flexor exercise. This is going to do absolutely nothing, and this is actually going to give you. This is trying to actually put you in this exact position. I don't understand anyone who uses this at all. This is just complete mental. So anyway, even if you were doing this, if that's all you do, you're not going to get very far anyway, because the minute you stand up, it's all going to come apart. All right, so the knee's not really the problem, it's the joints above and below it that you've got to try to resolve. So how do you know if you need to stretch or not? So, well, in some cases, especially post ACL surgery, And I've had problem even post ACL injury, and you didn't have surgery. There's incredible stiffness, and I know this firsthand because it happened to me. So, and this is where you might have to use some unloaded flexibility exercises, and even getting extension back. You may lack. This is me placing a sandbag on to get the mobility back. So in some cases, this is absolutely essential, and it's the very first thing you must try and do. Even though there's incredible stiffness, you've got to sort of work on it. But you've got to also work on it in line with the other things. So for the people with general knee stiffness, however, it's not that easy. So you have to try and identify your postural position in a standing position, just static, and also when you're moving. So the testing is crucial. So the best way to stretch for someone is either with a partner or a therapist, where you're lying flat on the table or on the floor, and they get it to do. If you're on your own, it's literally, you could probably do it lying flat face down with a towel and pulling your head leg behind you. If you're able to do the Swiss ball one, that's a great one. By far the better stretch of all of the quad stretches, just because it stretches the hip as well as the knee, where the standing one just stretches the knee, and that's why it's so much easier to do, because remember, the rectus femoris crosses the two joints. Remember I showed you before, it crosses both joints. So sometimes it's actually more stiffer at the top than the bottom, and you won't know that unless you do the stretch this way. When I'd not stretch. So if I would stretch, if I was a general knee person and I found that hard, I would probably use that stretch, but also knowing that I need to look at other things. When I wouldn't stretch is if I did that stretch and it wasn't hard to do. So in that kneeling position, it looked reasonably normal. I would conclude that that's not really stiffness. That's the problem. It's weakness. So and also when another big thing that I'd see is when I watch this person move. If they move in a posterior pelvic tilt, which we saw before with this squat, but also with the poor bending action, I know that their quadriceps are working excessively hard due to movement problems. No stretching is going to change anything, because the minute they move having to use their quads all the time. They have no other way of moving. They're basically just dominating everything through their knee joint, even though it's causing them huge problems, because their program in their mind of how to do things is the only one they've got. So therefore, in this case, the stretching is just going to make things worse, even make where they're weak even weaker. So what I really want to focus on is getting them to learn how to use their hips correctly through correct deadlifting positions, and spending a hell of a lot of time with deadlifting and single leg stuff, and right at the very end using squats. So the lack of hip movement forces excessive movement in the knees, and this person will continue to do this. All right, so the people would benefit more from posterior stretching followed up by strengthening of it. All right, so where we're sort of using like glute stretches and try to get this person to become a much more hip dominant, to share the load and avoid stressing the patella and the knee joint so much as they are normally doing with this sort of thing, where it's 100% quads with no help from the posterior chain. All right, so ankle mobility, I don't want to sort of rule this out, and I could almost add in foot stability here because they're sort of tied to each other, but you know, these very much can ruin the kinetic chain and rob the quads of their strength in the movements like the squat, because say for example they just don't have the mobility to get the knee to where it is here, and this is where the VMO is at the front. Remember, this is often where the real pain and the stiffness is, right here, and this is where that person's getting stiffness and pain because they're so weak, and that's because they never actually can get in this position because their ankles are the problem. All right, so you can see how there's so many other factors that I would look at, and to correct it I probably might use all of them in a sort of a circular fashion, where I'm just working on all of them in a row and doing the integrated strength work at the end. All right, so but always understand, if the mobility is lacking, the body must compensate and create new methods of movement that eventually lead to more pain, more dysfunction. So the instability on the single legs, we're sort of moving towards the single leg and sort of breaking down how you start to see. I've got here a sequence here where foot stability from overpronating internally rotates the knee, shifts it in, and the pelvis is sort of rolling forward. I could almost reverse this and have that 1, 2, 3, 4. So it sort of could work from the other way around. It could be also all of them at the same time. It could chop and change in movement patterns as well. So it's really impossible for me to give you a template to say this is what you do all the time. You just have to test everything to find out where your problems are lying and address the specific problems for you. Basically, the results of the test determine where your focus should be for your strength and stability training. With my single leg exercises, and I sort of mentioned before, I prefer to start with the deadlift just because also it's the least painful one. Deadlifts I can always do, even people with knee replacements I can do deadlifts. They can't even squat with their own body weight, but they could probably lift a 100 kilo deadlift off the ground. I'll start with deadlifting first before progressing to the much more difficult single leg squat. This is essential for the person in the posterior tilt, as we spoke about before, because this is the correction to their postural problem or their movement problem, their coordination problem of doing everything knee dominant. It basically just allows them to shift the head of the femur back to glide into the hip acetabulum so as it's meant to be, so it gives them the optimal stability of their hip joint, and it starts to create restore all the alignment problems and also restore the imbalances between the tonic and phasic muscles as you start to develop more strength in the weak areas. Eccentric single leg squats would be another version. That's sort of a just off a low box there, quite a challenging exercise. Adding extra bands to sort of force them. So firstly using a lunge stance and then progressing to single leg deadlift, single leg squats. This is a great way to sort of really encourage all of the guys to work, and I'm basically here trying to force them to do the wrong thing so that they have to adapt and react to it with the right movement strategy, and it basically creates harmony through the hip, the knee and the feet to give them the optimal alignment so that patella tracks in the right groove. Now I would leave squats right to the end because that's the movement that can really bring it all together, but it's also the one that can really pull it all apart. So it can really make things a lot worse. Basically really demanding a lot of stuff, and it must all go perfectly smooth. That's why if you get it right, especially these front squats, they're great for the quadriceps strengthening and having the mobility at the same time. But like I said, it can also make things worse if you do it too soon. So and it can be really the secret, the key that you were looking for all along. So that's an example also where I mentioned before you might need to tighten up to loosen up. So it's the stiffness was actually weakness, not actually truly stiffness. So the technique's everything. So you've got to take your time. If you do too much too soon, you overload the patella. If your technique's not right, you overload the patella. If gradual progressive overload is the key there. So always quality over quantity. All right. So in summary, spending time to assess where your problems are hiding will ensure your knee mobility and your ability to move is good forever. Don't ever skip steps, and be careful how much volume you use. Too much too soon adds problems to you. The quadriceps are unique, so you've got to understand that they're not all the same. So it's sort of, that's why you need to have a combination of mobility with a bit of stability and strength, and you've sort of got to work around and round in circles until it restores itself back to where it's supposed to be. Pay attention to the things like if sitting with your feet tucked under your chair, if you kneel all the time, things like that can be hidden problems that are causing it to be like that. All right, so for more exercises, specific exercises with instructions, make sure you grab a copy of this. The description's under the video here below. That'll give you all of the way that I put all of that together, and there's heaps of articles that you can check out as well. All right, so I hope you enjoy that video, and we'll see you on our next one.